Thank you all for joining us. I first want to start by thanking so many of you who've written in, posted, called with well wishes for Marlon and I. I'm grateful to report that both of us continue to do well. Very mild symptoms. This is just such a lottery when you get this thing. I saw that the single biggest hospitalized group is in our age range, 40 to 64. There's more people hospitalized today in Colorado, 40 to 64, than there are 65 plus. Obviously, your odds of being hospitalized if you get it are higher if you're over 65. But by sheer numbers, 40 to 64 is the biggest group. And about 4% of people my age who are perfectly healthy wind up in the hospital. So taking two of us, Marlon and I, household, we have about a 1 in 12 chance of one of us being hospitalized. So we're hopeful and optimistic that we'll be among the 11 and 12, but not everybody will by the very nature of math, by the nature of statistics. 11 and 12 will be fortunate. 1 in 12 couples or families will have a hospitalization. Many will make it out of the hospital after a challenging recovery. Some won't. The key thing is that we have enough hospital beds, both ICU and non-ICU, for those who need hospitalization. I'm certainly not out of the woods, nor is Marlon, as we know, this can certainly take a different turn after several days. But so far, I feel very good, and I'm grateful for all the kind words that so many Coloradans have sent our way. Now to our special guest, and before I turn it over to the nation's top infectious disease specialist, Dr. Anthony Fauci, I want to give a quick update on our numbers. 4,405 new cases today in Colorado, 36,690 tests. We had several days with the 40 and 50,000 tests. There's still a little bit of a slowdown, I think, from the Thanksgiving period. We're encouraging anybody with symptoms to go out and get tested. We have the capacity to do 60, 70,000 tests a day, and really only 30, 40, 50,000 Coloradans are availing themselves of that. So go to covid19.colorado.gov. There's over 80 testing sites. There's large-scale ones you drive through. Sometimes it's a 15-minute wait, sometimes it's an hour wait, but you get through quickly. Your doctor, your hospital, there's a number of ways to get tested if you have symptoms or if you think you might have been exposed, and that can prevent additional infections. With that, I want to turn it over to Dr. Anthony Fauci, who joins us, which we are so grateful for his wise counsel. As you know, he's been on many calls with the nation's governors, including me. We've asked many questions. We've also been joined by national experts like Dr. Birx, who joined us in Colorado. Dr. Fauci is joining us virtually, and we're so honored to give him this opportunity to give some thoughtful words of advice for Coloradans in this difficult time. Dr. Fauci.
Governor Polis, thank you so much for giving me the opportunity to speak to you and to your constituents about this extraordinary period of time that we're going through. First of all, I heard you're addressing them concerning your own health and that of your partner. I'm really happy to see that you're doing fine, but you're a strong guy. I think your constituents should realize that you're putting on a good face, but this is something that we need to take seriously, as I know you do, and as you've articulated that to your citizens. So I think it's important to emphasize a couple of points. First of all, Colorado is not alone in seeing a spike in cases. I know when you're living in a certain location, appropriately you focus on your own immediate environment, your own immediate city, town, state. But if you look across the United States, we are really in a public health crisis right now, because we're having a surge, the likes of which is worse than the surges that we all saw in the late winter, early spring, which was dominated by the Northeastern corridor, namely the metropolitan area of New York City. Then we had another surge that had an incline, an inflection point of a certain level that was dominated by southern states that were trying to reopen the economy. That was Florida, Georgia, Texas, Southern California, Arizona, and states and regions like that. That brought up the baseline of daily infections from 40,000 a day to about 60 to 70,000 per day. Now that we are in the mid to late fall, merging on into the winter, we have seen, because of a variety of circumstances, a surge that has really surpassed the others, where we have between 100,000 and 200,000 cases a day, between 1,000 and 2,000 deaths per day, and over 90,000 hospitalizations. This is something that is quite problematic, and to say it's challenging is to really say the least. We expect, although we, and including your own governor, have almost been pleading about the kinds of things we need to do to mitigate as we get into both the colder climate as well as the holiday season. But we anticipate, given the numbers of people that have traveled and that have engaged in the kinds of family and friends gatherings indoors for dinners and other gatherings, that what we are likely going to see, and I'm going to get to in a minute that we can do something about it, a surge upon a surge. And what I mean by that is that the numbers were already going up. You usually see about 2.5 to 3 weeks following an event, whatever that event is, that precipitates new infections. Traveling is an event. Holiday gathering is an event. Indoor types of congregate settings is an event. So what we have seen already is the event has occurred, and we're going to be seeing the result of that in the next couple of weeks. Instead of thinking in terms of the Thanksgiving holiday and then the Christmas holiday as two separate events, I think we're going to be looking at 30 or more days of a period of time of precarious risk. Because even though we're so-called out of the Thanksgiving season, we are rapidly going to emerge into the season of people shopping, crowding, preparing, perhaps even the ill-advised office parties, if they can exist anymore, and then the Christmas holidays, and then New Year's Eve and New Year's Day. So we have about a month or more of a situation where it is in our hands right now to see if we can mitigate it. And you mitigate it by the things that Governor Polis has been telling us to do and that I have been reiterating over and over. Uniform wearing of masks, physical distancing, avoiding crowds and congregate settings, particularly indoors, doing outdoors. And we realize sometimes the weather does not permit this, but as much as you possibly can, outdoors versus indoors, and wash your hands frequently. Avoid the things that we know are pleasant and desirable, though they're dangerous now, like family and friends getting together, 10, 12 people inside a house with poor ventilation in a situation where a single person who is without symptoms and infected can infect several of the people in there, including those who are vulnerable to severe consequences. So it's not too late to do something about it. As I've often said, and I'll repeat it for you, that help is in fact on the way. Vaccines are literally on the threshold for us. In the month of December, today is December 1st, in the month of December, towards the middle and end of December, we will be having available about 40 million doses of vaccines for 20 million people that will be allocated to the states according to population. And then locally, you'll have the option with recommendations from the CDC and the ACIP, the Advisory Committee on Immunization Practices, to make the distribution according to the high priority groups. As we get into January, February, and March, and we get more and more of the priority groups, we will soon, as we get into April, have vaccines for the general population, for the 20 and 30-year-old healthy man or woman who wants to get vaccinated. Once we get there, we can crush this outbreak, just the way we did with smallpox, with polio, and with measles. So we can do it. We just need to hang together a bit longer, because not only Colorado, but so many states are at the brink of being overrun with regard to their capability of taking care of people in a proper way, particularly in intensive care. So I want to just close by just making a comment of tipping my hat and saluting the very brave frontline healthcare workers in the state of Colorado who put themselves on the line literally every single day, every single night, endangering themselves in certain respects in order to take care of the people of Colorado. You really are heroes, and thank you very much for what you're doing. So I'll stop there, Mr. Governor, and I'll be happy to answer any questions.
So grateful, Dr. Fauci, and thank you for sharing your Colorado-specific observations in the context of what's happening nationally. Sort of the biggest outbreak areas, upper Midwest, we're kind of on the periphery of that geography, experiencing some of the most severe outbreaks. None of us expected to face something like this, but your guidance and expertise has been a steady source of reliable information for millions of people across the country. We're so grateful. Before we get to the discussion, I want to update Coloradans on economic aid. We announced a one-time direct stimulus for 435,000 Coloradans who had lost their jobs at some point during this crisis. I'm proud to say those payments are going out this week, hitting bank accounts automatically. You don't need to do anything. If you file for unemployment and meet the criteria, you should get that $375. We know it's not enough, but we hope that it helps to buy groceries, put food on the table, make your rent, and of course, we continue to call upon Congress for economic action. There was some breakthrough with that today, and I applaud Senator Bennett's efforts, Colorado senator, to lead a bipartisan way to break the stalemate in Washington, and we wish them well. Look, Coloradans, we want to hear this message, and we say it many times in many different ways. There is hope, as Dr. Fauci said. We are very close. Mile 22 or 23 of the marathon, I get that it's the hardest. I don't run marathons, but living in Boulder, I have many friends who do and have trained to do that. And yes, the last few miles are the hardest because you're about to drop dead and you're exhausted. This is a different kind of tired. We're tired of not seeing our friends and loved ones. We're tired of not having the quality of life we know we want to have. But you know what? We're almost there. We're almost there. We expect to inoculate our most vulnerable early next year, healthcare workers and others late this year. We are close. So we need to make the right choices to wear a mask when in public, stay at least 6 feet from others, avoid gatherings outside of our household whenever possible. I know that we can do that. I'm going to start with two questions for Dr. Fauci. One of them we get is on masks, Dr. Fauci, and we have a mask requirement in Colorado. You have to wear them when you're indoors. But I hear from people all the time, I have a friend who wore a mask and got it. I have a friend who didn't wear a mask and didn't get it. But can you just talk about the fact that we basically have something that's like a vaccine with 50% efficacy already here, and it's called a mask, and that you can't let, the difference between the statistics and the science and anecdotes, and maybe just comment on what it would mean for everybody if folks were wearing masks indoors around others?
Well, Governor, I think you said it very well. No intervention is 100%. But if we disregarded interventions that are not 100%, we'd be in a lot of trouble. We know that seatbelts save lives for absolutely certain. But occasionally, there's a car accident that's severe enough that someone is wearing a seatbelt and they still get severely injured or even die. Does that mean people should not wear seatbelts? Absolutely not. It doesn't detract from the advantage. It is very clear that wearing masks clearly have a positive impact in preventing you, if you happen to be infected, from transmitting to someone else. And also recent data indicate that it also prevents you from acquiring infection from someone else. So you will hear examples of people who wear masks who get infected. That expected because it's not 100%. But I will guarantee you, if no one wore masks, because we have data to prove that you would see many, many more acquisitions and transmissions of infections. So we don't want the expectation of the perfect to be the enemy of the good that masks can do. Therefore, wear masks, wear them, as the governor said, indoors as well as outdoors when you can't avoid people. I think one of the points I want to make, Governor, is that the anti-mask people say, I see people in the middle of the wilderness on a trail where there's no one but a moose or a raccoon, and you're wearing masks. Of course, you don't need to. You could put the mask down when there's no one within 300 yards of you. But when you're close enough to people, when you pass them, wear a mask. But where you really should wear masks is when you're indoors and you're in situations where you cannot avoid being very close to people.
Yeah, and it is a requirement in our state to wear them indoors in stores if you're working around others. But what I've urged people, Dr. Fauci, is you don't just do it because it's the law. You should follow the law. You do it because you're protecting yourself, and you care more about your own life and your family's life. I mean, it's striking that here we have two small kids, and there's a 1 in 12 chance that one of us could be in the hospital in a week, and that's a startling thing. And I don't want more Coloradans or more Americans to have to go through that. Not to mention, of course, the 1 in 12 who actually do, and then some of those will make it, and some of those won't. One final question. You've done a lot of work over your career on HIV and AIDS research, and that hits close to home for me because I'm a gay American, and so many Coloradans, so many Americans lost beloved family members in the 80s and early 90s to this plague. Some of them before they even knew what it was or knew that they had treatment. There is still no vaccine. There are therapies that are fairly effective for HIV and AIDS. But how can you compare just the massive ability to move forward so quickly with this one and what that promise means? For those who sort of been patient for decades on the AIDS side, working tirelessly in as you have in the field, and then to see this progress so quickly and how we just need to get through the next few months and put that in the context of some of the much longer struggles that we've had with other viruses like HIV.
Yeah, very good point, Governor, because it is very unfortunate for our planet that we're going through a pandemic now of such historic proportions. We have never seen anything as severe as this for the last 102 years. That's the bad and the sobering news. The encouraging and good news is that we were fortunate enough that the advances in the technologies of what we call platform technologies of vaccines has allowed us to do in weeks to months what normally would have taken several years. So the rapidity in which we now have a safe and very efficacious vaccines, plural, more than one, is a testimony to the extraordinary and exquisite scientific advances that have taken place over many years, which people don't realize because it isn't on the front burner of everyone. It's quiet, meticulous science that allows you to get a vaccine that's 94 to 95% effective from the time the virus was recognized in January of 2020 to the time we're putting it in a person's arm in December of 2020 is extraordinary, unprecedented, and quite frankly, Governor, unexpected. Even with my cautious optimism that I live by, I didn't think that we were going to have a 95% effective vaccine. So we have that on our side. And I want to encourage the people of Colorado to look at the data that's transparent and that's independent and make the decision when the vaccine becomes available to the people of Colorado. Please get vaccinated for your own safety and for the safety of your loved ones and for the people of Colorado in general.
Yeah, I was in Congress, Dr. Fauci, before I was governor, and I've long been a critic of FDA. I thought they should do for everything what they did for HIV drugs and fast track them, and things are available in Europe before they're available here. And credit where credit was due. People know I'm a Democrat, the president's a Republican. I want to give President Trump and Dr. Hahn great credit, among others, for Operation Warp Speed. The difference this makes just in terms of a few months can literally save tens or hundreds of thousands of lives. So we're very grateful, help from all quarters. The science is the science, but then expediting the unnecessary paperwork, doing a reasonable risk and reward measurement and understanding that in normal situations, paperwork has its purpose, but understanding the unprecedented nature of this through Operation Warp Speed. We're very grateful for all involved. I know you advised on that as well. I want to thank you. With that, we'll open it up for questions.
Governor Steve Steger from 9 News. First, it's good to see that you're doing well. I have two questions, one for Dr. Fauci, one for the governor. First for Dr. Fauci. We had a recent experience here in Denver where our mayor ignored his own public health advice, traveled for the Thanksgiving holiday. What's the impact when people who make public health guidelines secretly act in these hypocritical ways? And how does that impact the public confidence in the guidelines and the buy-in? And for the governor, you've called business owners and county leaders who ignore restrictions bad actors. You've called Coloradans who don't wear a mask selfish bastards. Yet we haven't heard you say a critical word about Mayor Hancock's travel. Isn't that creating your own issue of hypocrisy?
Well, let me start off by, rather than making a specific comment about a specific person, I'll just repeat something that I believe will answer your question. And that is, I've always said that mixed messaging, particularly from people in authority, is really something that countermands the kind of messaging that we like to get to people so that they understand what the appropriate thing to do. And wherever the mixed message comes from, particularly if it comes from a person in authority, is not only not helpful, it can actually be detrimental to the purpose that you're trying to get a message for. And in this case, keep yourself safe and keep the people around you safe.
Yeah, and what I've said in response to the mayor's travel and Congresswoman-elect Boebert having 30 plus people over for Thanksgiving is I honestly wish them well. I hope they don't get it. I hope their loved ones don't get it. That's all that can be said. Anybody who's not wearing a mask where they should, I hope you don't get it. My hopes, my prayers are with you. We know that you are putting yourself and your family at greater risk. Of course, I wish that less people traveled over Thanksgiving. And that includes the mayor. I wish that people didn't have large Thanksgiving dinners, and that includes Congresswoman-elect Boebert. But it's really about the individual choices that people make. And yeah, there are Coloradans that are not wearing masks as well and are still having gatherings. Ultimately, they're the ones that are putting themselves and their family at greater risk. But despite that, my hope and my prayer is still that they are among the lucky ones that do not contract this deadly virus, or if they do, among the lucky ones that do not require hospitalization or exceptional care to make it through.
You know, there's one other point, if you allow me, Governor, to make with regard to what you said that I think it's important for people to understand. When you don't do mitigations that you know can prevent infection of yourself and those around you, it goes beyond yourself, because one can make an argument, I'm young, I'm healthy, if I get infected, the likelihood that I'm going to get a serious outcome doesn't matter. You can't think upon yourself as being in a vacuum, because by getting infected, you're propagating the outbreak. You are part of the problem instead of being part of the solution. And by propagating the outbreak, you're allowing it to continue, because you're being a vehicle for the virus to hop around from person to person. What you really want is that when the virus gets to you, you want to be a dead end for the virus. You don't want to be a facilitator of that virus getting to someone else. So it's not only protecting yourself, it's not only protecting your loved ones, it's being part of the solution to the outbreak as opposed to a facilitation of the outbreak. It goes well beyond you and your family. It's part of the big picture.
Next question.
Hi, this is Erin Prater with the Gazette in Denver and Colorado Springs. Dr. Fauci, in your opinion, is Colorado doing enough? In our state, as I'm sure you know, we have a COVID dial, and we have 20 plus counties that are in red. A couple of weeks ago, the red stage would have been a lockdown, and now purple is lockdown, so we have no counties in lockdown or stay at home. Given our numbers, are we doing enough as a state? And for Governor Polis, do you know how you contracted COVID-19? Thanks to you both.
Well, you know, that's almost an unanswerable question. Well, what is enough? I mean, enough is when you don't have any more infections there. But I understand the point you're getting at. And I think it does relate to the issue of lockdown. One of the issues with locking down is that it essentially pushes on and I would think amplifies the issue that people are feeling that the governor mentioned, this idea about COVID fatigue, that if you lock down, you might actually discourage people enough that they just throw their hands up and say, you know, enough of this, I don't want any part of this, which is the reason why let me make sure people don't misinterpret what I'm saying. It may come to lockdown. I think if you start to see overrunning of your hospitals and your healthcare systems, I can assure you that there will be serious consideration for lockdown. But what I've been saying now for weeks and weeks, if not months, is that you don't have to resort to lockdown if you uniformly do the 4 or 5 things that we talk about all the time. The masks, the distance, the avoiding crowds, the indoor issues that you want to wear a mask, you want to do things more outdoors than indoors. If everybody did that across the board, I will guarantee you that you will turn around the dynamics of the outbreak and you would not have to go to lockdown. It's when you have some people doing it and some people not, as opposed to a consistent adherence to interventions that we know work. I mean, if you look at country for country or state for state, and you compare those that are comparable demographically and otherwise, those that mitigate turn things around. Those that don't, the projection of the outbreak continues. And that's just a fact, because that's actually what's happened.
Thank you. And right now, 1 in 41 Coloradans are estimated to be contagious with coronavirus. So there's exposure I knew about, other potential exposures. There's also the exposures that I didn't know about that I might have had. So 1 in 41 Coloradans. And that's why every time we interact with others at the grocery store, walking your dog, you should make the assumption that that person could be contagious with coronavirus, because there's a 1 in 41 chance they are. Many are asymptomatic or pre-symptomatic, but still contagious. So take those precautions with everybody, because if you interact with 40 people in a grocery store, chances are at least one of them is currently contagious at that moment in time.
Hello, Governor Polis. This is Vinny Del Giudice at Bloomberg News in Denver. I have questions for you and the doctor. First for the doctor, I'm sorry, my computer just rang a bell. First for the doctor, when do you anticipate universal vaccinations for every American who wants one? By June? And can Americans as businesses start to plan for an autumn 2021 that involves going back to offices and schools and the skies? And for the governor, when do you anticipate universal vaccinations for every Coloradan who wants one? Thank you very much, gentlemen.
Well, with regard to the distribution of vaccines, as I'm sure you've heard, it's been in the media that the first level, very likely healthcare providers and individuals in nursing homes and other high priority individuals will start getting it in December. As you get into January, February, and March, you will then get the second, third, and fourth level of people who are essential to society, people who are school teachers, people who are children, blah, blah, and on, until you get to what you're referring to, namely the ordinary man and woman in the street, the normal Coloradan or United States citizen or occupant of this country. When can you start getting it available to everyone, and when will everyone be vaccinated? Because those are two separate questions. It likely will be started to get to the vaccine for those who are not in the higher risk categories somewhere in April, middle to end of April. Once you start getting vaccine going, if you have good uptake, namely the overwhelming majority of people want to get vaccinated, you can expeditiously vaccinate people that by the time you get to the mid to the end of the second quarter of 2021, namely May, June, July, August, you very likely could have overwhelming majority of the people vaccinated, which means you'd have herd immunity that would allow you to safely get people back to school in the fall, to safely get people back to the kinds of works that would otherwise be difficult as you get to the middle and end of the summer. So it's going to start in April, and it's going to go right through the end of the second quarter of 2021.
And I just wanted to clarify, Dr. Fauci, we did hear you over the weekend, and we agree in Colorado. It's devastating, of course, for our bars to be closed. They've been closed since June. Restaurants don't have indoor dining. We did that in part to make sure it's safe to open our schools. We're focused on schools being open in January. Many are open today, some aren't. In weighing the unweighable, I just wanted you to comment about the relative risk of bars and nightclubs and the relatively smaller risk of schools.
Yeah, I have a very terse saying when people ask me that: close the bars, open the schools, and that's it. And that really succinctly says it. It's clear when you do tracing about where you get these kinds of outbreaks. It's bars, indoor seating at restaurant, particularly at full capacity. And when you're in a restaurant, it's very tough, if not impossible, to eat and drink with a mask on, unless you figure out something that I don't know about. So when you're in a restaurant, and particularly if you're at full capacity without good ventilation, then you got a problem. But bars are particularly problematic. That's the reason why we say if everyone closed the bars, you'd have a lot less trouble keeping the schools open.
And I want our Coloradans to know that this is the very reason our legislature is in a special session right now, working on bipartisan economic aid for restaurants and bars, because we know that it's not fair to ask them to put their entire life and business at risk. And so it's going to provide the help to get them through for the vaccine. And I think Dr. Fauci addressed the vaccine. I would just only add that 94% efficacy, higher than anticipated. That means that to end the pandemic, everybody doesn't need to get the shot. Once enough people have it, the disease is still with us. And by the way, the disease will probably be with us in 5 years and 10 years. But the pandemic aspect of it is over once a sufficient number of people have been vaccinated. I'll leave that to the scientists to say whether that's 50% or 70% or 80%. But it's a lot lower percentage of people before the pandemic's over at a 94% efficacy than it would have been if the vaccine was only 60 or 70% effective. Next question.
Hi, it's Jessica Seaman with the Denver Post. Dr. Fauci, you talked about that first tier of the vaccine going to healthcare workers. I've heard from some healthcare workers concerns about the safety of the vaccine. So how do you see challenges in getting even healthcare workers vaccinated for COVID-19, and how might you address that issue, from a messaging standpoint?
Well, I think what you just said, the last thing is the important thing. It's in the messaging, and get healthcare workers to understand what the process of the testing is and why we feel confident when the FDA comes out and says that a vaccine is safe and highly efficacious, why that is a fact that you can actually believe. First of all, these vaccine trials were done in an enormous number of people. The Moderna trial was done in 30,000 people. The Pfizer trial was done in 44,000 people. The results were monitored very carefully by an independent data and safety monitoring board, not by the federal government, not by the pharmaceutical company, but by an independent group of scientists, clinicians, immunologists, virologists, statisticians, ethicists. They looked at the data and independently determined that it was safe and effective. They then gave the data to the company, which presents it to the FDA, whose career scientists who do this for decades. They're not political appointees. They're career scientists. They look at the data, and together with their own advisory committee, which is the Vaccines and Related Biological Products Advisory Committee, referred to as VRPAC, that is yet again another independent group of individuals who recommend that the vaccine is safe and effective. Then, before they do an EUA or an emergency use authorization, the FDA waits 60 days from the time 50% of the people in the trial got their last dose. Why 60 days? Because we know from decades of experience with vaccines that 30 to 45 days, 90+% of all the adverse events occur. So if you wait 60 days, you've already covered the time when almost all of the adverse events occur. And then you declare the vaccine safe and effective. I think if every healthcare worker realizes how transparent and independent the process is, they would feel much more comfortable about getting vaccinated. I know that you're seeing me now as a public health person, but I am also a healthcare provider, and I also see patients, and I will get vaccinated when my time arrives. I promise you that.
And I will as well. Next question.
Dr. Fauci, this is Chris Vanderveen with 9 News here in Denver. States that were hotspots really just a few weeks ago, states like Wisconsin, North Dakota, South Dakota, and yes, in Colorado, now appear to be leveling off, at least preliminarily, with cases almost in unison. None of those states had uniform restrictions in place, yet they all appear to be doing the same thing at the same time. Is something else going on here right now that could explain what's going on in these states that goes beyond just restrictions and mitigation and human mitigation efforts?
Yeah, certainly there may be things that we aren't fully appreciating. But, when you see situations where people have not been mitigating and they get a big outbreak, and then all of a sudden the outbreak turns around, it's because once you get things really bad, you don't fully appreciate it, but people do start mitigating. They likely should have been mitigating 3 weeks earlier, but you look at the states that do, ultimately everything comes down because people get frightened when they see so many people get infected. But what happens often is that you start to get a little bit of it that really reflects people changing their behavior as you get into it. One of the things that you should keep your eye on is that as we get 2 to 3 weeks beyond the Thanksgiving holiday, that it is likely, as we mentioned a little bit ago, that you're going to start seeing the curve that had gone to flatten out go back up again, unless people really have done a considerable degree of mitigating.
And I imagine this will keep grad students busy for decades studying why and when and how the different peaks occurred.
That's for sure.
Next question.
Governor Polis and Dr. Fauci, my name is Sarah Flower. I'm a reporter for KSUT, Four Corners Public Radio in Ignacio, Colorado, on Southern Ute Indian Tribe land. I have 2 questions, one for the governor. Firstly, sir, I'm glad you and your partner, Martlin, are feeling better. But as here in Southwest Colorado, we are the only region in the state thus far that has 0% availability for ICU beds. What is the state's plan to increase healthcare and resources for residents and frontline workers in this region? And secondly, my question goes to Dr. Fauci, where Colorado is in the process of looking at a business best COVID-19 practices certification program, or a 5-star program that would allow some businesses such as restaurants and bars to have in-person dining, which you are stating so far that is a very high risk activity. Dr. Fauci, would you recommend that the state of Colorado continue to pursue a program that would allow for indoor dining at bars and restaurants?
So we are in close discussion with the tribes nearly daily with our public health officials and our 2 sovereign Indian nations. We mourn, I think, one of our first losses at the tribal nation. We also work the area both on the New Mexico side and the Colorado side, and we've seen a even larger peak in many of the areas in the New Mexico. We realize that the communities, in many ways, the state dividing line is an arbitrary line between the communities. The hospital capacity is shared, the community capacity is shared. We're doing everything we can to make sure that we can meet the needs of any Coloradan that requires hospitalization anywhere in our state, and that certainly includes members of our tribes. And Dr. Fauci, let me give some context on the next one. Right now, Colorado has outdoor dining is fine. Most of our state does not have indoor dining. There's a few parts that do. Part of what is being looked at for indoor dining are what kind of additional safety protocols can be certified at restaurants to get back to 25%, maybe 50%, and what else do they need to do around certifying mask wearing and families dining together and symptoms checking for staff, and what are those above and beyond things that can help them get back to a little more of a sustainable model. while being consistent with protecting the public health. And so there's a draft out on that now, and people are commenting on it, public health, business, et cetera. And that's what that sort of 5-star was in reference to. If you kind of certify 5 stars, you meet these other criteria, you can start having a bit more in restaurant dining up to a certain capacity level.
Yeah, well, I mean, I thank you for putting it into context, because it's difficult to make a comment on something in which you're not really actually sure what's on the table and that's being discussed. If the purpose of this endeavor, whatever it is, and I want to get more generic than specific, that whatever you are trying to do, you look at the options that you can get the function that you want, but you do it in a way that safeguards the people who are involved. And that may be, as the governor said, right now it's mostly outdoor. If you want to get indoor, it's reasonable to ask the question, what can I do with my restaurant or with the restaurants in general that would allow some degree of indoor dining that would not put people at substantial risk? That could be to provide certain types of ventilation. That could be putting HEPA filters in. That could be by spacing tables. That could be by testing all of the staff, frequently enough to know that you're not spreading it from staff to people. That could be the mask wearing. There are so many things that you could do, and not every one of them are going to work necessarily, but I think it's appropriate to at least examine, if you are going to consider indoor dining, what's the safest way to do it. If you can't figure out a way that's the safest way to do it, then you might say, we can't do it. But if you're going to do it, at least do it in the safest way as possible.
So, Dr. Fauci, Charles Ashby from the Grand Junction Daily Sentinel, I was told to jump in as soon as you stop speaking. I'm in the county that started that program, and it's supposed to be expanded statewide. So I have a question for you, or just a comment maybe, to tell you that the health department people here are very bully on that program. They watch it and monitor it very closely. The businesses that are accepted in it all agreed to do all the things they're supposed to do: mask wearing, cleaning, testing. And those that falter are dropped from the program, and therefore they go down to a lower variant. So to the governor, I noticed that last night that program was sort of put into Senate Bill 1 to expand it statewide. So I'm curious to know how that's going to be rolled out throughout the rest of the state, and what do you do about those counties such as Garfield, who has already said they don't want to do it?
Well, certainly nobody has to do it. But there is a draft right now. There's draft guidance out that we want input on. I would say the whole state is also watching the success of Mesa County with regard to the 5-star program. We're cheering for you. We're hoping it demonstrates. We're hoping it works, continues to work well. We're hoping those cases brought down. We know that Mesa has some of the higher rates in the state, but we are hopeful that these additional protocols and safety measures that businesses implement are the pathway to allow for more capacity. So that's open for comment statewide. Obviously, no county has to participate, but there has been a lot of interest. As Dr. Fauci indicated, we just want to learn the best, healthiest ways that we can do the most possible. It's not in any way, shape, or form a statewide mandate. It's just an option for counties that want to pursue it.
Hello, Doctor and Governor. This is Faith Mangan with Fox News Channel. The question is for the governor. With vaccines seeming so close, can you talk about where Colorado's priorities are currently for distribution? In particular, why those who are incarcerated may get access before those 65 and older or who have high-risk conditions. Also, do you have any response to DEA George Brockler's critical op-ed on this topic?
Yeah, well, I mean, that won't happen. There's no way that prisoners are going to get it before members of the vulnerable population. Now, as we do 65 and up, I would think that would include prisoners that are in that category. But the vast majority of people 65 and up are free. It'll first go to people in nursing homes, veterans facilities, frontline workers. There's no way it's going to go to prisoners before it goes to people who haven't committed any crime. That's obvious. So those are just false. Clearly, the actual proposal on how we're going to do it will be amended. It'll be released next week, kind of the way we're going to look at that. I think we're awaiting some work from CDC. Maybe Dr. Fauci can update us. I think there's a national model prioritization. We're going to take that and tweak that. and we will give it, we will establish that, as I said, next week in a more clear way. We've heard something's coming, Dr. Fauci, on prioritization. I know it'll be up to the states, but can you talk a little bit about what's coming nationally on that?
Yes, the CDC today, Tuesday, is meeting with the Advisory Committee on Immunization Practices a little bit earlier than what would have thought, because they really want to get the states to be well aware of what the prioritization that is agreed upon between the CDC and the ACIP, so that the options, whether it's healthcare providers plus nursing home residents and staff, things like that. They're literally discussing it now, right now.
And then it's my understanding that we could then take that and either adopt it altogether, or we can tweak it a little bit as a state to meet our unique needs. Is that kind of
absolutely? You are totally correct on that, Governor. These are recommendations that will be made to the states. The final decision of how you tweak it, you can either do it exactly as they say, tweak it a little, tweak it a lot, or say, for our state, it's a bit different. We want to do it this way. The option is at the local state level.
And I want to thank Dr. Fauci. In closing, I want to encourage Coloradans to avoid social interactions with people outside their household. Wear a mask whenever you're around others. Keep your distance. Be careful. Any parting words for the great state of Colorado, Dr. Fauci?
Yeah, well, hang in there. We're all in this together, Governor. Thank you for giving me the opportunity to interact with you and with your constituents. And as I have said, and you said, that help is on the way, and we are going to get out of this. We will get through this, and we will be back to normal the way we were before this particular plague hit us, and do the kinds of things that we enjoy in life with our friends, our loved ones, and all of our colleagues.
Thank you so much, Dr. Fauci, and thank you, Colorado.